that, I would like to now turn it over to Dr. Justin Ballinger, who's the Deputy Director of the AUC Data Science Initiative, who will be the host today. So thank you, Dr. Ballinger, and who will introduce our speakers. And Dr. Ballinger, would you like to take it away?
All right, thank you so much, Dr. Washington. And again, welcome everyone for this edition of DS3 Directors Lunch and Learn. We are certainly in for a treat. We'll be taking a look at data and health in space, and we have some esteemed guests who are going to be joining us today. And they'll go in the order that I'm introducing them. First, we'll have Dr. Michael Douglas, who's a professor of kinesiology at Morehouse College and also serves as the chair of the kinesiology department at Morehouse College. And he'll be talking about some of the research and collaborations that we're building across the Atlanta University Center as it relates to space health. Then we'll have Mr. Walter Groteke, who's the founder and CEO of MyMedicalHUB, which will be a partner with the AUC Data Science Initiative. And they are doing some amazing work around physical therapy, particularly as it relates to providing that service for those who are engaged in space flight and long duration projects in space. And then last but certainly not least, we'll have Dr. Yvonne Cagle, who is a NASA astronaut, medical doctor, and test pilot, colonel in the retired colonel in the United States Air Force, who will be sharing some information in relation to one of her inventions, a medical device that supports enhanced rehabilitation in space for those who are injured with soft tissue injuries, as well as how data science is being used to further health science in space. So we're excited about our guests who will be joining us today, and we're really looking forward to what they're going to share with us. And I think we'll take a moment to read out the poll, and then we'll start with Dr. Douglas. So I think you've had a chance to respond to the poll, so we'll get to see who's joining us today.
We'll do the poll at the end, Dr. Ballinger, after the presenters. Yeah.
All right, so we'll start with our presenters, and Dr. Douglas, you'll be up first. Thank you.
All right, so excited to have everybody join us today, and excited to be a part of the AUC Data Science Initiative. Again, I'm Michael Douglas, chair of the Kinesiology Department at Morehouse College. And I'm excited to work with my colleagues, and what we're going to do is kind of give you some analog, like where we are now with musculoskeletal assessment, and then where we're going with AI and machine learning. So next slide, please. Okay, so musculoskeletal evaluation. So clinically, as an athletic trainer in sports medicine, I use the selective functional movement assessment as a clinical assessment for patients that present to the clinic with pain. And what it does is it systematically finds the cause of pain and not just the source. So what generally happens when someone presents to the clinic with something, let's say they present with shoulder pain. Typically, the clinician goes to the shoulder, does an eval, some special tests. They'll ask some questions, get some history, et cetera, and treat the shoulder. The selective functional movement assessment, what it does is does a full body assessment to assess for dysfunction. So when I was introduced to Dr. Cagle and MyMedicalHUB, I saw the presentation, and my response was, okay, they're really in my head, and I got really excited to work with them. But the SFMA, Selective Functional Movement Assessment, is a movement-based diagnostic system which helps us find the source of pain by looking at dysfunctional movement patterns in a structural, repeatable assessment. Next slide, please. So in the top tier assessment of the SFMA, we see cervical flexion and we see cervical extension and also cervical rotation. And what we're looking for is if there's any tissue extensibility dysfunction, meaning that there's some tightness. We're looking for range of motion. We're also looking for pain to see if there's any pain presentations. So this is usually the part of the exam. If the patient did not present with neck pain, this is the part of the exam where the patient is saying, what are we doing? My knee hurts. Why am I doing cervical flexion, extension, and rotation? Next slide, please. The next part of that top tier assessment is the upper extremity patterns. So we want to reach over and over the top and touch the scapula and come back on and reach to touch the scapula bilaterally. And what we're doing with that is we're looking for shoulder dyskinesis. We're looking at shoulder range of motion. We're looking at, again, tissue extensibility and also any pain that may present itself. Next slide, please. Then we move on to multi-segmental flexion, extension, and rotation. And this gets, our motor units involved from a multi-segmental standpoint. We're looking for hip movement. We're looking for, in the rotation, we're looking for less than 50 degrees of range of motion. If we get excessive motion, then that means there may be some tissue extensibility. In our flexion extension and flexion, we're looking to see if that patient can touch their toes. And in extension, we're looking for their ASIS to see if their ASIS goes over their toes. So next slide, please. Then we move into our single leg stance, and we do this bilaterally. If you look closely, hopefully you're able to see this. I added why I didn't add it. It's not my assessment to add, but in this particular assessment, you can add a vestibular component by having the patient close their eyes. So we're looking initially if one, they can control their body from a motor unit standpoint, maintain their balance. We're looking for hip symmetry and seeing if they can control their muscles in that particular posture. And then once again, when we close the eyes, we add the vestibular component to it to see if they can maintain that posture with their eyes closed. Next slide, please. And then finally, we have the deep squat, which has been long used as an assessment tool for musculoskeletal assessments. This particular squat, we're doing arms down, and we want to make sure this patient can touch the floor within their footprint with their hands. And so what we gather there, we can look for weight shifts on the way down. We can look for overactive muscles. If you look at this particular patient, this particular model, you see that their feet have turned out. This assessment starts with the feet, at a perpendicular angle. So their toes are pointed straight. So as they're on their way down, we can see if there's any overactive muscle activity, typically in the anterior tibialis, and we start to see the feet turn out. In addition to this, with the arms down, we can look again at tissue extensibility in the upper and lower extremities that will prevent them from getting into that particular position. There's another variation of the deep squat where you go overhead and you can look, for excessive forward leaning in that squat position. And that would give you some indication that there's some dysfunction in the upper extremity as well as the lower extremity that would need to be addressed in order for them to be able to do these movements the way you would like to see it. Next slide, please. So once we determine where these dysfunctions are, then we want to address these dysfunctions. So you want to start where you have a functional movement with a dysfunctional movement with no pain. That means they're doing something wrong and it's not currently causing pain in that particular area, but it may present itself as pain someplace else. And one of the modalities, that is used clinically is a mobilization with movement. So I chose this graphic of the fingers and strings. I lost my presentation, but I chose the graphic with the fingers and strings to demonstrate tensegrity. So if we think about a cable bridge, and if we, disrupt any of the cables in that cable bridge, then it's going to disrupt the integrity of the bridge itself. And so the body itself, the human body is wrapped up in fascia. And so, that tissue extensibility, we can typically, remedy that with some sort of mobilization to increase that joint range of motion. So mobilizations with movement is the concurrent application of sustained accessory mobilization applied by a clinician and an active physiological movement to the end range by the patient. And so the passive end range or overpressure or stretching is then delivered without pain as a barrier, because typically if there's some type of tissue extensibility, sometimes there may be a little bit of pain associated with that particular movement. If we take pain out of the equation, then they can perform the movement. And then that'll also let us know that we're in a dysfunctional area that we can address as a clinician to remove pain, not just from that particular area, if there's pain present, but also pain elsewhere in the body. Next slide, please. So what's going on? So, how did we get here to where we needed, this type of musculoskeletal assessment? Well, naturally, we're all sitting in front of some type of device at this very moment. And our sedentary society has produced a less healthy, non-functioning population that's prone to injury, with minimal activity. And so, as a result, musculoskeletal pain is more prevalent now than it was, 50 years ago. And so in the emergency room, public health data, has demonstrated that, there are a lot of clinical presentations for musculoskeletal pain, most of them being ankle sprains, hip problems, knee problems, et cetera. And so there's definitely a need to have an adequate assessment tool, for clinicians to be able to assess, patients properly, because what happens in our system is, these are often diagnosed on the surface. So they present it with shoulder pain or they present it with knee pain. They got sent home with a few instructions, and these injuries, turn into dysfunctions, some additional dysfunctions, and those dysfunctions present themselves as pain elsewhere as they continue to progress. And so we can see that 22% of all musculoskeletal encounters were from ankle sprains and from lower extremity injuries. And these typically occur, in the home with normal people. Next slide, please. Okay, so now what are we going to do? We're going to take all of the science that we have currently, and along with patient-reported outcomes, that we've received from selective, functional movement assessment, from mobilizations with movement, and we're going to put it to use by creating some protocols that we will use with MyMedicalHUB and that technology to create some AI and some machine learning as a result. And what this will do for us is help us minimize our musculoskeletal dysfunction, across the populations. And we're going to enhance our rehabilitation process and develop conditioning and reconditioning protocols for different populations, on planet Earth and beyond. Next slide. Here are a few references used in this particular presentation, and also want to thank, my model, Ms. Vanessa Hale, who's also an athletic trainer, head athletic trainer for Clark Atlanta University. That is all. I'll turn it back over to our moderator.
Thank you so much, Dr. Douglas. And now we'll have a demo of sorts that's going to come from MyMedicalHUB. Again, this is an amazing advancement in the use of AI and machine learning in modeling physical therapy. So I'll turn it over to Walter Groteke, the founder and CEO of MyMedicalHUB, to demo this amazing technology. Thank you, Walter.
Yeah, thank you, Dr. Bellinger. And thank you, Dr. Douglas, for that great presentation. Look, I'm honored to be here alongside of people like Dr. Talitha Washington and the other members here, Dr. Yvonne Cagle, an inspiration from NASA. In this part of the presentation, we're going to look to explore the transformative impact of AI and machine learning in space and its ripple effects on healthcare. I want to thank everyone for joining us. I hope this discussion today sparks curiosity, collaboration, and a shared vision for the future. In order to give you a perspective before we delve into the main part of the presentation, I'm going to pass this over to Andrew Verna, who works here at MyMedicalHUB, and he's going to walk you through a video demonstration of our technology.
Yeah, so essentially what we do here at MyMedicalHUB is we've created a way to risk stratify individuals and identify their level of musculoskeletal health. And so the way this starts is through an assessment. So the assessment has two phases. Phase one, where it's in the form of an online questionnaire where the patient fills out a number of questions regarding their activities of daily living, things they do every day, put stress and strain on their joints, ligaments, lesions, overuse injuries. The patient then answers questions regarding medical history, family medical history. So we find out if this person is predisposed to certain medical musculoskeletal conditions. And then we get into chief complaints, things that are currently bothering them, or maybe things that flare up from time to time. And we do a deep dive on that, find out what types of pain are associated with the chief complaint, what types of treatments have they tried to alleviate the issue, is there any tingling, is there any numbness, et cetera, things like that. And then we'll ask on a scale of 1 to 10 what that pain is like. And as you can see here, we put descriptors. So if someone says my neck hurts and it's a level 5, they know 5 means this is something that I can no longer ignore, it's impacting my life. Phase 2 is what you're about to see now, and this is where our AI comes into play. Now, I don't know if you can hear her speaking right now, but essentially the way that this works is Emma, our efficient musculoskeletal management assistant, walks this individual through a number of different biometric movements, provocative tests, orthopedic special tests. Our AI is measuring in real time the ranges of motion. It's flagging any asymmetries in the ranges of motion. It's flagging whether or not these provocative tests or biometrics are triggering pain. And essentially, once all of this data is collected, our algorithms stratify that information across like profiles or lives that have already been through our platform and identifies their level of musculoskeletal health and risk. In addition to that, it creates a very detailed report of findings that lays out all of their ranges of motion, where they're deficient, where they're okay. It shows a summary of positive findings. It shows all of the risk factors that are predisposing people to musculoskeletal health. And depending on the level of risk our AI has identified, will create an online generated care plan that this person can do to either treat an issue that's going on with them or intervene and stop catastrophic injuries from happening before they occur.
Yeah, I'd like to also point out we're offering a free self-led postural screen to all attendees. We'll provide the details of how to do that at the end of this presentation.
Now, in addition to this, and Walt, if you want to go on to the next screen. Now, in addition to this, we have a essentially a phone-based app. So once you've done this assessment, and again, depending on your level of risk of suffering a musculoskeletal injury, you'll be assigned different physiotherapies to do. And using our phone-based app, Emma will watch you doing these physiotherapies and count your reps and count your sets. So you can train along and find out how you're doing. And if you take a look in the top left-hand side of the screen is where the reps are.
Return.
It might be a little difficult to hear, but Emma does speak and walk you through this stuff. With that, I will turn it back over to Walt.
Thank you, Joe. So how AI and MO works for MSK autonomous decision support in remote settings. There's a couple of things I want to mention, and Dr. Douglas brought up the objective part of the movements to identify these pain areas. It's interesting, if you ask a person subjectively whether or not they have pain, right, the brain is very positive. So if somebody is very powerful. So if somebody has something going on, many times the body, right, the brain will change things, how we do things in our everyday ordinary lives, right? Without those provocative tests, it's difficult to identify these pain points. And the evaluation that Dr. Douglas had shown is a great evaluation for identifying where people may have pain and by drawing it out of them through those provocative movements. So when we take a look at this, how does this work? How does MyMedicalHUB do it, right? We do this through data collection, right? We standardize on an evaluation. There are subjective and objective movements that we capture. You saw in the previous video, we utilize computer vision to do this, right? And we use this to ingest the information. The great thing about the way in which data collection is done, right? We could do this virtually anywhere, right? We could do this any place here on Earth or in space. All you need is a smart device to do so. And then after the data is collected, it's organized and then processed through advanced neural networks of language models, right? This step is essential to help train machine learning algorithms, ensuring the system is continuously learning and improving, right? Every single assessment that goes through our system, our environment can learn from it. And the other thing I want to point out here, the type of data that we're processing when we perform a musculoskeletal assessment, we're collecting over 1,000 points of musculoskeletal insights on somebody. So think about that for a moment. When you perform an evaluation, how many data points are you going to really be able to remember in a full musculoskeletal evaluation? By leveraging a machine learning environment that can capture and ingest this information and then organize it in a way for you to get a more holistic view of what's going on with these patients is paramount. The other thing I want to bring up here is we're all different, right? We come from different personal health histories, family health histories. We likely have different chief complaints. The activities of daily living that each one of us do are different. How we would perform provocative tests are different, right? So if we were to assess all the attendees here, right, you would see a very diverse set of these backgrounds, right? Diverse set of data. However, by looking at this data and developing profiles, right, of like lives to yourself, if you had the benefit of looking at other like lives of people who have had similar ailments, right, and how best they were overcome through interventions, where you now had a predictive pathway, right, to remediate an issue, think of the value of that. The other thing I want to mention is machines, right, and machine learning, it removes the variability from provider to provider, right? A machine is going to evaluate everybody, regardless of who they are, the same way every single time. And then, of course, the last part is leveraging a machine learning ecosystem such as this, right? You now get to see the perspectives of other experts, right? We've seen this before. What is the confidence if this particular intervention is applied? Is this person likely to meet the intended goal of that intervention, right? And over time, the more data that goes into this environment, the more people that go through this environment, right? Where it's like an ongoing living study, right? To get to a holy grail. As new breakthroughs happen and new studies get ingested into this environment, this is a type of environment that can identify those candidates, right? And who would be likely to respond to those new breakthroughs, okay? So once the system processes this data, right, the system not only collects and processes it, but it also organizes, tracks, and reports it. This organized clinical data aids healthcare providers in understanding treatment efficacy, enabling better and more informed decisions. So Edward Demings, right? We're a big believer in Edward Demings, right? So what are the 5 components that we do at MyMedicalHUB? Well, benchmarking, right? The first thing we do is benchmark, right? Our environment, we gather the essential insights about the patient, their health status, and the broader context in which they exist. Our standardized assessment collects, as I mentioned earlier, over 1,000 points of data on a patient. This provides a clear picture of where we're starting from. The next thing is a baseline, right? We create a baseline in order to make criteria-based matches. With the insights from benchmarking, we establish a baseline. This involves creating criteria-based matches that tailor the assessment and intervention process to the individual's specific needs, ensuring personal care, right? It's not a one-size-fits-all. And that's where we get into the next part. Number 3, the triaging, right? Triage allows us to help determine the best interventions for a particular patient based on their unique health profile, right? How do we develop that unique profile? We look at those 1,000 points of data. Where have we seen this before? And what's the confidence that this individual is going to respond to this plan of care? Are they meeting those intended goals, right? So we get into the monitoring aspect of it, right? Is the patient trending better? Are they same? Are they worse? Where did they reach maximum improvement, right? So continuous monitor is crucial to the patient. So one of the things that we've done here at MyMedicalHUB is, and you couldn't hear her talking before, but we've developed this EMMA, right? Andrew spoke about EMMA. EMMA stands for Efficient Musculoskeletal Management Assistant. We're training EMMA to follow up with a patient to see how they're responding to a care. So EMMA will not only walk you through a musculoskeletal evaluation, in the very near future, she'll even follow up with you. See how you're doing, see how you're feeling. How did you sleep at night, right? Are you experiencing pain? Are you frustrated? Are you depressed, right? Getting that real-time feedback in between office visits, we feel is critically important for a provider to provide the highest level of care and to also create potentially new encounters with that patient, right? If something isn't going right and someone's pain is increasing and they're becoming frustrated and depressed, right? There's a high probability a patient's not going to be compliant with that care. So it may be necessary to have a face-to-face encounter with that patient. And then lastly, right, assessing the efficacy, right? Did it achieve the desired outcome? And understanding, yes, if it did, or no, why it didn't, and refine the models, okay? Okay, remote capabilities. At MyMedicalHUB, we've harnessed the power of technology to offer remote capabilities. So it doesn't, like I mentioned earlier, we're not bound by four walls. This is something that could be done in the convenience of someone's home, an office, out in the battlefield, or even the vast expanse of space. So the platform is designed to work and function seamlessly regardless of the environment, okay? Providing, again, that there's some type of a smart device. This type of flexibility ensures that quality healthcare is accessible regardless of location. So those two types of modes that we have the ability to do this is an Emma-led self-assessment, where you can literally invite someone to your provider portal. Emma will walk them through the evaluation. The system will alert you when that assessment is complete, and then we'll provide you with a report of findings on that patient. A second way is through a telemedicine environment. We've given providers a type of a heads-up display that when you're in that encounter, it will record the actual assessment as you're walking them through it, and then generate the report of findings immediately afterwards. Either way, you get the same report, whether Emma does it or whether the provider performs the assessment, they're both the same. So we here at MyMedicalHUB, right, we're ensuring that distance or location never stands in the way of quality care, okay? Even if you think about it, even in rural areas here in the United States, where there aren't potential specialists involved, right, this provides a way to get access to those rural populations. I'd like to just take a moment to have Dr. Cagle talk to the significance of this slide, if you can, Dr. Cagle, please.
Great. Okay. Yes. Hopefully everyone can hear me okay, but you'll see a young woman who is floating with a yellow shirt on. And for those of you who don't know, this is Dr. Mae Jemison. I and others personally call her the Queen of Telemedicine. During this mission, STS-92, her mission, she flew probably one of the very first applied telemedicine platforms, and is wearing an autogenic jacket that is assessing biometrics and trying to mitigate or remediate motion sickness issues that you can have when you're in a reduced gravity or microgravity environment. So telemedicine was probably the first, space was probably the first telemedicine platform ever. By virtue of its own natural default and in the environment, that you can't just run down the street to the doctor's office. And Mae was one of Dr. Mae Jemison, our first African-American female astronaut, was historically one of the first people, if not the first person, to really study and transmit health data in this kind of telemedicine platform. And she's still doing that today through her 100-year Starship, Future Innovations and Technologies for How We're Going to Sustain and Thrive in Space. So you can Google her and learn more about her and what she's doing. But I just wanted to give a shout out to one of the sets of shoulders of giants that we all stand or float on. Thank you.
Thank you, Dr. Cagle. You know, it's interesting. You know, I'm fascinated with the knowledge that Dr. Cagle has. She's taught me a lot about, you know, the deterioration or the deconditioning of what happens to the human body in space in these long-term space explorations, right? So think about it. Our musculoskeletal integrity here on Earth, right? We're bound by gravity, right? We have muscle memory, right? That helps to keep our bones and structural system, right, in alignment. But in a microgravity state, right, you lose muscle memory. So think about what happens after a month, a 6 months, a year, and beyond, right? When you're in that microgravity state, and how rapidly the muscles, the discs in the human spine, right, decondition. So having a deeper understanding in the profiling of these astronauts, right, is really important, right, to figure out what type of deconditioning at an accelerated rate is happening from individual to individual and how best to mitigate it. So with that being said, right, how do we address this, right? Well, pre-mission profiling and optimization. So, before embarking on a mission, it's critical to understand an astronaut's health profile, right? What's that benchmark? What's that baseline, right? Where are they at before they actually go off into space? And then machine learning environments like MyMedicalHUB can assist this by providing knowing that their skeletal unique environment of space poses challenges. Zero gravity can have a myriad of effects on the human body, which we just discussed. Continuously monitoring can help in early detection of potential issues, allowing more timely interventions, with these astronauts. What type of interventions can they do in space, right, to mitigate those issues? Are there biologics that can be employed for example? So this is really all new uncharted territories for us, but we're going to look to get a deeper learning, a deeper understanding of what happens in these types of environments. And then post-mission, right? When an astronaut returns to Earth, their journey's not over yet, right? So having that previous benchmark and baseline is important because you want to be able to restore their health back to that pre-flight status, right? So again, having these benchmark and baselines is important, but also think about populations of people here on Earth. Think about the biometrics that are employed today to get a health status, right? So think about biometrically how care is provided. There are certain commoditized biometrics that are available, right? Blood pressure, glucose levels, right? And others, right, that we have. But for musculoskeletal, it's been a challenge, right? Biometrically evaluating one's musculoskeletal health and looking at changes that are happening over time. Over time, things like our gait changes, right, as we get older, or if we have early onset of Parkinson's disease, right? We know that there are deviations and changes in gait. Imagine having a feasible way of benchmarking and baselining these things and creating these biometric measures, right, to help to identify early detection of certain diseases. Okay, the transitional benefits, right? Well, the vast expanse of space offers a unique environment. The lessons and innovations we gain from exploring it have a transformative impact right here on Earth. So let's talk about this, right? Healthcare access and equity. At the heart of our mission is to democratize healthcare, right? By utilizing MyMedicalHUB's capabilities, right, we can ensure that quality healthcare is accessible and equitable to everybody, right? Regardless of their location, regardless of who they are, where they are, right? So that's one of our missions, right? More personalized medicine. We've discussed that no two people are the same, right? We're talking about data here, right? I'm super passionate about data. How we're going to transform and make healthcare more through machine, right? So delivering more personalized, tailored medical interventions based upon those unique profiles, we believe will transform care. And having these machine learned ecosystems such as MyMedicalHUBs, right, and identifying who's a candidate for what as breakthroughs happen, and having this part of your ecosystem as part of your practice, right, is going to help the populations that you serve. Military, right? Mentioned, Dr. Cagle's a former colonel in the Air Force. She knows us all too well, right? Our servicemen and servicewomen, right? They face unbelievable challenges, right? Musculoskeletal issues is the #1 problem that they have. We work with an organization that does over 400,000 disability assessments a year on either existing military members or retired ones. It's a massive problem, right? But ensuring early detection of risks in order to prevent these people from getting injured and helping them to optimize and making sure that they're healthy in those roles that they're playing in our military is of paramount importance. Sports medicine, right? I'm sure many of us have played sports either at high school or in collegiate, right? People are pushing their bodies, right? So, understanding if somebody is predisposed to an ACL tear, even an ankle injury, right? Helping them, make them aware that these risks exist, right? And how to remediate them in a more timely way is super important. And then streamlining, screening, and triaging, right? We spoke about the importance of that. Remote monitoring and telemedicine, we spoke about that as well. And I think we all agree, right? I'm sorry.
We're running a little close to time, so
okay.
We had time for Dr. Cagle to share for a bit, and then make sure we have time for question and answer. We only have an hour, so sorry.
Thanks, Doc. Sorry about that, Dr. Bellinger.
No,
yes,
no
and now I'll pass this over to Dr. Cagle.
Great. Thanks, everyone. It's great to be here. I'm about to kick this discussion off planet. We're going to take it out of the room and kick it off planet. And the things that you've learned, I'm going to give you an opportunity to think about how you would apply it in the operational setting of space. And so with that, I just want to kind of set the tone a little bit. It's been 8 minutes and 30 seconds. You're approximately 250 miles above the Earth, going 17,500 miles per hour on your way to Mach 25, coming off of 7.5 million pounds of thrust. And in exactly 8 minutes and 31 seconds, you have now become the alien that we go in search of. Your body is no longer the same as it was when you left the planet. Your DNA base pairs are shifting. You're 2 inches taller. Your heart has shifted to the middle of your chest, and your plasma volume is accumulating and floating up your body into your chest and expanding your skull size, leaving your legs depleted of hydrostatic pressure and without the resistance of your crutch called gravity that you've taken for granted all your life to support, stabilize, and propel you. At 90 days, your growth hormone has bailed on you enough to the degree where your muscles are now deconditioning at about 10% of muscle loss per month, and your bone density at 1% loss per month, possibly plateauing at about 17% unless you extend your stay in space or altered gravity as you're floating amongst the stars. There are no more giant leaps in space, only weightlessness and inertia, unless you manage to find a way to push yourself off structure or find a way to lasso and accelerate yourself around an axis like your body or the moon that we typically use to leverage lunar assists in order to accelerate ourselves around the dark side of the moon. Otherwise, we are functionally lost in space while inside of the vehicle. And injury is an accelerant to all of those conundrums that space introduces and at times imposes upon our body. So if you're looking at the screen now, you'll see in the before picture a very large, swollen, we call it brawny, discolored, darkly discolored foot. This is a triathlete who rolled his ankle 2 days prior. You can see the tape that he has on it right now isn't doing him a whole lot of good. His race is in 3 weeks. He has 10 out of 10 pain, can't fully weight bear, can't climb stairs, can't train, unlikely to make that race. Primarily because if this were your foot, it would take me and others as a clinician a minimum of 10 weeks just to rehabilitate, and you would most likely not be competitive any longer. But the problem is, this is not you were not a triathlete. And remember, I've launched you off the planet. You are not on Earth. You are in space. So this is your foot on Mars. You don't have 10 weeks. You don't have 6 weeks. Within as little as 6 days, you've deconditioned enough where this foot may no longer be able to be remediated, which means you're down to 3 limbs. If this were your arm, and we don't use our legs very much in microgravity, then that would put you 1 limb away from losing all of your MSK functionality for movement, for feeding, for emergency evacuation. 6 days. What are you going to do? What are you going to do? Well, look at the after picture. This is the same foot. If you look closely, you can see the remnants of the taping up his leg, and he even has a corn on his second to the last, the 4th toe. Same foot. This wasn't 10 weeks. This wasn't 10 days. This was not even 10 hours. After 10 minutes, he no longer had pain, 0 out of 10 pain, fully weight bearing, able to climb stairs. 2 days later was running, made his race in 3 weeks. If this was your foot on Mars, it looks like you're coming home after all. No longer will you be that permanent Mars resident. This is what we're dealing with in space. So that's what happens when we shrink wrap. The difference that made this so rapid, so amplified and accelerated is because I've invented a wearable wrap technology that is applied very comfortably, but is able to shrink recovery times, reconditioning times from weeks into days, and discomfort and swelling and stiffness from days into minutes, where within 10 minutes, you can be partially loading on that involved limb. This is for soft tissue, not for structural damage like torn tendons or broken bones, but almost all injuries are associated with this. What's important to note is that this is also for deconditioned tissue. So whatever causes the deconditioning, whether it be injury or pandemic or space, this is something that can amplify and accelerate. Now, we haven't been able to really benchmark this because there's no way to really assess soft tissue other than functional movements like Dr. Douglas talked about. But now with AI and ML, we can look at in a very accelerated fashion changes like this, not over months, not over weeks, but in minutes. We can assess the improvement in stability, range of motion, strength, pliability. This is just one of the examples of why it's so important for us to look at where we are as we move through missions in space. Remarkably, we've discovered how to move space vehicles through altered gravity environments such as launch, landing, cislunar, and soon onto Mars, as well as our return back to altered gravity environments such as home, Earth. But what strikingly pales in comparison is just how little we know about how the human body moves through space and needs to adjust, adapt, and sustain, as well as thrive in altered gravity environment as it moves through the gateways and corridors of space, let alone how we as humans will evolve over time. So space normals are imperative. It's imperative for us to begin to build a database of space normal using AI and subject matter experts such as Dr. Douglas, who can cooperatively work together to remap the human body in altered gravity environments, to begin to provide sound predictive models in a vacuum like we call space. And using what we've learned from the panelists, we are well on track and trajectory to do that. And the 4 things that we really need to work on that this will enable are the 4 A's: amplify, automate, autonomous, and accelerate. So to amplify, using linguistics models to help train the AI through machine learning, we can map the human body, remap the human body in space, as well as other analog conditions back here on Earth, to accelerate our understanding, aggregation, sharing, and like we did during telehealth, during the pandemic is be able to blast or broadcast that very rapidly so that we can gain research insights amongst our science communities and clinical communities, and to advance our knowledge pool and practice, all the way from twin studies to small N-of-1 science, such as what we have to do to space, where the N size is so small that we have to use the individual as their own cross-match control in order to really gain those insights. And also here on Earth, where you're in remote environments that might not be readily accessible to the cloud. Secondly, to automate. Platforms like MyMedicalHUB that use computer vision. And right now, MyMedicalHUB is the only one I'm familiar with that allows for us to detangle from pads and wires on the human body. At the same time, it can continue to be complementary to other multimodal IoT and biosensors, but it enhances our ability to capture that multidimensional biometric information. And best of all, it's using the interface of an iPhone or an iPad like we have in space. That's lightweight, easy, and ubiquitous. Thirdly, autonomous. With linguistic models and visual chat personalities like Emma, non-healthcare professionals can gain standardized, diversified, and personalized insights that can be readily shared for decision support with other healthcare professionals once they reconnect to the larger healthcare community. But in the meantime, it can be an autonomous access for non-healthcare professionals, such as crew members, the majority of them, to be able to still gain insights and advance their care. And lastly, to accelerate, having the capability to benchmark, baseline, triage, track, and trend dynamic MSK data in real time and continuously allows us to accelerate the efficacy and optimization of personalized treatment and restoration care plans. In summary, space is becoming more and more of a discovery laboratory in as much as it is a demonstration laboratory as we have here on Earth for space. And although there is nothing like space on Earth, unless you live in a rural or otherwise socially, economically displaced environment, space poses challenges in zero gravity that can have mirror effects to analog conditions here on Earth. And so returning our knowledge to Earth, there are so many benefits that we can glean in order to continue to advance our level of care back here on Earth. So now with AI and ML, we can look at MSK data in ways we have never had perspectives on before. MSK data now has both vision and voice and can illuminate and verify transformative changes in real time, while at the same time moving at the speed of light as AI and MSK data unmasks through linguistic models our ability to keep pace with the rapidly emerging horizons of future tech that are accelerating at the regenerative, competitive, and now, yes, even galactic edge of human readiness, performance, and resiliency. Thank you so much for your time and attention. I'll turn it back to our panelist and moderator for any other remarks or questions in Q&A.
Thank you so much, Dr. Cagle, and thank you, Dr. Douglas and Walter, for the insights that you shared with the use of medical data and its applications both on Earth and in space. Very excited about this continuation of work. Just out of respect for everybody's time, we're a couple of minutes over, so we will do our best to respond to questions that were put in the chat for Q&A. So if you do have additional questions, please feel free to drop those into the Q&A. And I'm going to go ahead and read out our poll results for everyone who participated today. So it looks like about 26% of individuals that are on our call today are students, 74% are graduated or working professionals. Of our student population, 3% are freshmen, 3% sophomores, 9% juniors, 3% seniors, 9% master's students, 11% PhD, and 63% are not currently enrolled as students. So that means that we mostly have working professionals on our call, 37% female, 60% male, 3% not identifying as male or female. And then about half of our participants are in Georgia, and a little over half, about 51% are in Georgia, but not the US. We have 3% international participants. And then we had a couple of space trivia questions. The hottest planet in our solar system. We had, what was the temperature for that? Was it 450 degrees Celsius, 650, 850 or Celsius? And correct me if I'm wrong, but I think our hottest planet is 450 degrees Celsius, Venus. And then question number 6, a full NASA suit costs $100,000, $500,000, $2 million, or $12 million dollars. And you can see what our answers were for that. And I don't know if we have our answer for that.
Yes, it's going to be 12 million.
$12 million.
Well,
One suit.
Oh, wow. All right. Well, again, thank you all for joining us for this Director's Lunch and Learn. Amazing insights. Again, thank our esteemed panelists for the time that you shared with us and the amazing insights that you shared. And we look forward to this continuing collaboration across the AUC and beyond as we continue to extend opportunities on Earth and beyond and into space and back to Earth. So again, thank you for joining us, and we'll look forward to seeing you next month for our next Director's Lunch and Learn. So I'll stop right here, and Dr. Washington or tell me if you have any closing remarks or items that individuals need to be aware of. I'll turn it back over to you. Thank you.
first of all, thank you, panelists, for joining us today. Thank you, Dr. Ballinger, for being a fantastic moderator. It's very enlightening. And I hope everybody has a great rest of your day and your weekend is off to a good blast-off start.
Thank you for having us.
Thank you.
Thank you.